Good morning, everyone. Share the screen again. Just went off. All right. Okay, let's get started. Good morning. So thanks for being here early today, and we shall get started so that we don't eat into too much of our time. Please sign in this QR code. Sign in using the QR code, and then at the end of the session, we will also have a sign out, and we will award the CPD hours from the information that we retrieve through the QR code scanning. All right, let's move on. This is our first training for 2025, and thank you for being here. I understand a lot of you have a lot of questions for our products and our processes, and I hope today we will be able to share with you the information we share with you today will be very helpful in your business. All right. First of all, an introduction to our team in Bupa. We have Jin Xian, JX as we call him. He's our BDM. And in the team, we have Li En, myself, Dorina, and Gauri. So the four of us will be assisting you with your inquiries regarding individual plans. So we are from the individual team, and we take care of the individual products in Bupa here in Singapore. All right. Just to give you an overview of what is the partnership between RHI and Bupa in Singapore. So for Bupa being an international company, we work with different partners around the world to bring the products into that country. So in Singapore, in particular, we work with RHI. So RHI is our insurer in Singapore, and we are the administrator of the international health plans here. So a little bit of the background about RHI. So since 2008, we have been working with them, and we have been providing the international health plans in Singapore. And if you are familiar, you will know that Bupa Global is actually we are not just an insurance company. We also do healthcare. We have our own hospitals and clinics in some countries, and we are actually one of the premium healthcare insurer worldwide. All right. And yeah, we have over 75 years of experience in terms of medical innovation, clinical technology, as well as we have customers worldwide in our hospitals, in our clinics, as well as our health insurance members. We have offices around the world. So for example, our customer service is actually operates on a 24/7 basis. All right, we have offices in Dubai, in UK, as well as in Hong Kong, where the customer service will take care of any inquiries that our members would have any time of the day and anywhere they are around the world. Okay, so how do members get in touch with them, and how do members access their information? We have an app that's called Members World. Inside Members World, our members will be able to access their policy documents. They can submit claims, do pre-authorization for their treatment, or they can even contact us through the messaging system in the Members World. And this would be the best way and the fastest way to reach us. On top of that, members will be able to contact us if they would like to have access to second medical opinion. This is a complimentary service that is provided to all members. And let's say, for example, they might have a diagnosis and they're not sure if that would be the best option for them, best treatment plan for them. They can actually come to us and request for an appointment with a relevant specialist so that they can actually inquire or consult further on what is the best way forward in their case. Pre-authorization for our, in order to make the claims a smoother process, to ensure that the treatment that the members are going for is covered in their plan, there are no exclusions, or to ensure that the medical bill, is within expectations, we would have our members do a pre-authorization so that their claims would be faster and smoother, and they won't be in a shock, when they come to know that, hey, maybe for some reason this treatment is not covered in their plan, or maybe because of overcharging by a medical professional, they are not able to get the full claim, because sometimes in certain parts of the world, we might have some specialists or some hospitals who are overcharging. So in that case, we would investigate and we would pay out what is reasonable and customary. And in that case, maybe the members would not be able to receive the full reimbursement in terms of the claims. As we go along, if you have any questions, you can also type it in the chat function so that we can attend to it later on, or after the session, we can send out the replies to you as well. Okay, for those who have joined us, we actually require you to scan in and out. Okay, so let me just flash the QR code again. Okay, if you can just quickly get a copy of this QR code and do your sign in. And at the end of the session, we'll also have a sign out. All right. Okay, back to our pre-authorization. Next, we would have we'll talk about how to claim. So a lot of our brokers, they have this question: how do we claim? How do we pre-authorize? What are your panel? Do you have a panel? Can we just go to any hospital around the world? So our plans are worldwide. All right, you have the option to cover including or excluding US. So you have the option to go to a specialist anywhere in the world according to the coverage of your plan. All right, the most important thing is to do a pre-authorization to ensure that the treatment you're going for is covered in your plan. And we do have a network. So some people call it panel, but in Bupa, we call it network. When you go to any specialist or any facility within our network, we can arrange for direct payment to them. But if you go to a specialist that is outside of our network, then it will be on a pay and claim basis. And like what we mentioned earlier, the member can submit the claims through Members World, or you can also help your client to do the submission of the claims through Intermediary World. And we will touch on Intermediary World a bit later. Right. So what are some of the benefits that our members get to enjoy as when they covered under IPMI? So IPMI is a very unique proposition for people who wants to have a more comprehensive cover, a high level of coverage worldwide. So you can see that we actually offer access to worldwide insurance, which covers treatment in any part of the world. We also have second medical opinion from specialists when you require some advice after getting a diagnosis. You might want to find alternative, you want to consult further to see if there are any alternative treatments available. So we'll be able to connect you with a specialist in that field to advise you further. Of course, our claims process is, if we have all the information that is required, is very straightforward and very fast, especially if you do a pre-authorization with us. All right, and we also have portability of cover. In many cases, if we have an office in that country that your customer is relocating to, we will be able to port you over to a compliant plan in that country. So sometimes it could be on a no further underwriting basis. Sometimes there could be some minimal simplified underwriting in place. So it depends on where they are relocating to. Right. We also be able to cover pre-existing medical condition in one of our plans, which we will touch on later. And a lot of people actually come to us because of this feature. Treatment cost in Singapore. As you know, it has been in the news a lot recently as well. We have ongoing, people has been talking about the cost of medical treatment in Singapore. In fact, Singapore ranks, among the top 3 in terms of medical costs around the world. Firstly, is the US, and then Hong Kong and Singapore. So we are considered one of the most expensive in terms of medical expenses. Therefore, you would see people talking about um, um, premiums for our plans, or not just for Bupa, as an insurance in general in Singapore. And you can see that a lot of insurers, they are not able, we are trying to contain the cost of claims, because we are seeing a high level of claims, a higher than usual number of claims, and the cost of claims are also higher as well post-COVID, because there are some treatment that were delayed during the COVID period, and now they're all coming back, as well as the change in the lifestyle, in people's lifestyle. So people, they are going for more physiotherapy. We're also seeing a lot of increase in mental health treatment, right? These are increasing cost of treatment. Also, in terms of cancer advancement, we see a lot of advancement in terms of cancer treatment, in terms of a lot of neurological or other types of treatment, which also means that the medical bills are much higher now, right? When people go for more advanced treatment. And, I believe a lot of you will go for regular checkups, regular health screenings. This will also mean that people are going for treatment earlier. And it's a good thing, going for treatment earlier. Therefore, you will see that our plans, they are very comprehensive. We don't limit, we try to encourage people to go for early treatment, in fact. All right, so this is just to give you an overview of what are the kind of treatment costs in Singapore that we see these days. Next, I think most of you have this question on your mind. What are the plans we offer and how do they work? Because every day we see a lot of emails and we receive a lot of calls from you asking, what plan do you have? What can my client buy? And this and that. So I'm going through the plans that we offer in Singapore. And if you have any questions after that, you can put in the chat, or you can also email us and we can go into more details with you. For agency leaders, if you have a need for us to have a more in-depth session with your team, you can always contact us as well, and we can liaise from there to arrange for a time to meet up, to go through more details with your team if you're interested. All right. Basically, in Singapore, we have two plans. The first one would be Worldwide Health Option. Okay, Worldwide Health Option, or we call it BWHO for short, BWHO. So BWHO plan, it is a modular plan. All right, it covers worldwide with the option to include or exclude USA. So your client can actually choose from the different modules according to their preferred level of cover. At the very core basic level would be worldwide medical insurance, WMI. This covers for inpatient, things like hospitalization, surgery, anything that is necessary for your treatment during a hospital stay. For example, the operating theatre, the room and board would be included in this module. Worldwide medical insurance is compulsory. So if you want to take up BWHO plan, you must have this module. And after that, you can add on the optional modules that you see in the green color circle. Okay, the first quadrant, you will see Worldwide Medical Plus. This would include outpatient consultation with specialists or with family doctors. Let's say if you require physiotherapy, alternative complementary medicine, consultation with psychologists, psychiatrists, this will be included in the Worldwide Medical Plus. So things like diagnostic tests like X-ray, blood tests will be included as well. But take note that when we go to see a specialist or a GP, the consultation is covered. But usually they would prescribe you some medication, right? Let's say painkillers or cough medicine or whatever medicine that they prescribe. This is not included in Worldwide Medical Plus, but it is included in Worldwide Medicine and Equipment. Second quadrant that you see here, Worldwide Medicine and Equipment, it would cover for prescribed drugs and dressings for outpatient. just now we mentioned anything that you require that is necessary for your treatment in the hospital, for example, the medication that you need to take during a hospital stay, that is actually covered in the worldwide medical insurance already. But for outpatient, when I consult a specialist, he prescribed me a medication, this will be covered under worldwide medicine and equipment. This will also include long-term medication. Long-term medication refers to medication that you require for at least 6 months. So the doctor prescribe you this medicine for long term, at least 6 months, it will be covered under prescribed drugs and dressings under worldwide medicine and equipment. Next, you see the worldwide well-being. This would be for the good to have options like health screening, mammogram, prostate cancer screening, vaccinations, or dental and optical benefits. This would be under worldwide well-being. A lot of our members, they would take this up sometimes as part of maybe their employer is paying for their insurance, international insurance, because they are an expat in Singapore. They would take this up, or some of our members, they might have family members who are not staying with them. Sometimes they could be staying in different countries, and they want to ensure that their family members are well taken care of in terms of their well-being, right? They want to have a most comprehensive cover. They will include the worldwide well-being as well. All right. We also have the worldwide evacuation. This refers to emergency medical evacuation and repatriation. What happens is perhaps maybe your customer is a businessman. Maybe he went to somewhere in one of the islands in Indonesia as part of his business. And during the trip, he has an medical emergency, maybe a issue and there is no hospital there that is able to take care of his treatment at that time, right? Then we will activate this worldwide evacuation to send him to the next nearest facility to get him treated. And upon treatment, after treatment, when he's stable enough, we could repatriate him back to either his home country or his country of residence. So in our just to bring up this point, as part of our application, we are concerned about where your customer is residing. So there are some countries that we will not be able to offer cover at this moment. But if your customer is residing in Singapore, Indonesia, or Malaysia, we would be able to offer cover to them. Right. Of course, these rules can get changed from time to time, and according to sometimes a change in the regulation in that particular country. For example, now we won't be able to cover customers who are residing in Thailand due to the local regulations. But these rules can change from time to time. So if you have customers who are residing outside of Singapore, it will be best that you call us or email us just to check, for the updated rules regarding the residency status. Right. Next, we have the three options that you can see in the dark blue boxes below. US cover, you can choose to have a worldwide excluding US cover or worldwide including US cover. Of course, the premium will be different. Like we mentioned, the US has the highest medical cost in the world. So if your client choose to include US, the premiums will be different, but it's very popular. It's a very popular option as well, as we have a lot of high net worth customers who would they would want to go to the US, for treatment in case anything were to happen to them. All right. Next, we can cover for pre-existing conditions. So out of the two plans that we have in Singapore, this would be the one to go for if your customer has any pre-existing condition that they would like to cover for. We can't promise that we can cover everything, but you can let us know the details of the medical condition, and we will be able to check with the underwriters to see if we can cover this with loading or if we can offer cover with exclusions. So these are some of the possibilities, or sometimes it could be an ongoing serious condition that is still having ongoing treatment. So in that case, we might not be able to cover. All right, but this is something that a lot of people look at when they come to us, coverage for pre-existing conditions. We also have deductible options. Deductible is the amount that you pay first, that you have to fulfill every year from your own pockets before we start to pay out the claims. So we have a range of deductible options that I can share with you later. And why people want to go for deductibles is to bring down the cost of the premiums. All right. So for Bihu plan, let me go into the details of the coverage. The overall annual maximum you can see would be 4 million Singapore dollar or 2.89 million USD. In Singapore, we accept SGD or USD. Your client can choose to pay in SGD or USD, and the claims will be paid out as well, according to the currency that they have chosen. All right, worldwide medical insurance. As you can see, it is to cover for day case, overnight hospital stay. It will include anything that you require in the hospital, like the operating theatre, the medicine, surgical dressings, ICU, HGU, the surgeon's fee, specialist fee, the pathology, the X-ray, diagnostic test. If you require physiotherapy during the hospital stay, is covered as well. Advanced imaging. So this is one thing that some people might have missed out. So advanced imaging refers to MRI, CT scan, PT scan. So if they require these 3 scans, it will be classified under advanced imaging in this module. I won't go into details because later after the session, we will send out the deck as well as a copy of the guide. You can read through the details of the benefits and limits. And if you have questions, you can let us know from there. Okay. Just highlighting some of the unique benefits that we have within our plans. For WMI, we also cover for childbirth and treatment, but there's a waiting period of 24 months. So some of your customers, they could be concerned about childbirth and treatment, childbirth in the hospital. So we do cover, but only after 24 months, right? Some people will ask, so can they get pregnant within 24 months? Yes, you can get pregnant anytime, but only those medical costs, childbirth related medical costs that are incurred after 24 months can be claimed, okay? Complications of maternity, medically essential cesarean, these are covered as well. And just to highlight to you, newborn care, we have this benefit where our members can buy a plan for their newborn for the first 90 days without further underwriting for the first 90 days of coverage. We will touch more on that later because there will be some terms and conditions attached to this. But just take note that this benefit is not for free. We have to buy a plan for the baby, and we have to pay the premium for baby in this in order to take up newborn care. Cancer treatment. The good thing about cancer treatment that we offer is that even if you were to take up only WMI, by right it covers just hospitalization and surgery, right? But when it comes to cancer treatment, we would cover in full. Because sometimes cancer treatment can be in terms of chemotherapy, radiotherapy, outpatient therapy. So even if you only have this core plan, WMI, we will still cover the full cancer treatment, right? Next, we have the ATMP, Advanced Therapy Medical Products. These are the most advanced treatment that you can find. It's especially helpful for complex cases like cancer. This includes things like gene therapy, cell therapy. These are the most advanced treatment that are available. So when it comes to this, also brings up a point in Singapore. Do we need to follow the cancer drug list? Is there any restriction on what is the kind of cancer treatment that we can cover for? So as long as a general guide, as long as this treatment is necessary in your treatment is necessary in your condition, for your medical condition, and it is something that is approved in the country that you are having the treatment in, and it is not something that is experimental and unproven, then it is likely that we will be able to cover. All right, if it is experimental, it's unproven treatment, or it is not something that is relevant to your treatment, it doesn't help in the condition that you have, then that will be subject to our approval. Okay. Right, so I won't take up too much time to go through each one.
IVF, we have a question. IVF.
IVF, okay. Let me see your question about IVF, sorry. Hang on. Someone has a question on IVF. Okay, so for we don't cover IVF if you're asking about whether we cover IVF. So we don't cover for infertility treatment. We do cover if the investigation for the reason of the infertility, but we don't cover for the IVF treatment per se. Okay. Cancer treatment will cover fully for the policy year. What happened the following year? Yes. So thanks for bringing up this question, Vicky, right? Yes. So a lot of people also ask, do we have a guaranteed renewability clause? So there is no explicit writing where we say guaranteed renewable. I don't think most insurers would do that because sometimes due to exceptional cases. But let me touch on this. We will not deny you the renewal because you have claimed. Whether you have claimed $1 or 1 million or 2 million, we won't use that as a reason for not renewing your plan. So let's say for cancer treatment, this year I claim 2 million. I can still renew and utilize the plan for my treatment again next year. We will continue the coverage. Okay, we won't exclude it after you have claimed. That's not what we do.
Hi, Dorina. This is Kenny here. Yeah,
Uh-huh.
bringing up the question on IVF. I got an additional question. If let's say IVF and then subsequently lead to birth, after the 24 months, would the cost be covered under the plan?
The cost of the childbirth, right?
Yeah, correct.
Yes. So for the childbirth benefit, we don't differentiate whether it is due to IVF or not. As long as it's a pregnancy, we cover the childbirth. Yeah. Hope that answers your question.
So the question, the Q&A.
Yeah, but we will, if you have further question, we can go into Q&A at the end of the session to go further on that. All right. Or you can type in the chat first so that we can go through one by one. I don't want to go through each benefit line by line, but I would like to highlight some that I find we have been receiving a lot of inquiries about. Then it will give you a very good starting point when you speak to your clients or you have further questions. It might trigger your further inquiries from there. All right, next we have the Worldwide Medical Plus. Worldwide Medical Plus, as you can see here, it covers specialist consultation, doctor's fees. You can see there is an annual maximum limit of Singapore dollar 58,650 or US dollar 42,500. Also subject to the number of visits per year. As you can see, specialist consultation and doctor fee up to 35 visits. So sometimes, a lot of times, if you look at our member guide, you'll realize we don't really have a lot of limits but imposed. But whenever there are at some limits, it's usually quite sufficient because if you look at 35 visits to the doctor per year, most people won't require 3 doctor visits to the doctor every month, right? So that's quite sufficient. Physiotherapy, osteopathy, chiropractor, psychiatry, psychologist, mental health is very high on a lot of people's concern. So we do cover that as well, up to 35 visits each membership year. All right. Things like you need an investigation into like you need to do X-ray, diagnostic test is covered also, right? Maternity, Worldwide Medical Plus also covers for maternity, which includes things like prenatal checks, that sometimes before when we are pregnant, we need to go to see the doctor every month for the checkups. Is covered under maternity. There is also a 24 months waiting period. Okay, same thing. For this maternity cover, we don't look at whether you conceive the baby through IVF or not. It will still be covered under maternity, but the waiting period is 24 months under this plan. Okay. Worldwide medicine and equipment, it will cover for outpatient medication, durable medical equipment, and long-term medicine. And you can see the limits applicable here. All right, each membership year. Okay. Worldwide well-being. Okay, so this will cover for health screening, mammogram, pap test, etc. There is a 1-year waiting period for full health screening. So your clients will have to wait for 12 months before they can go for this benefit. For dental and optical, there will be some waiting period. I'll share with you a summary of the waiting period later also. So these are some of the benefits that you can look at. Dental orthodontics, this will include things like braces, but this is only for children who are less than 19 years old. Okay. But I say these are good to have. So the benefits are not no, for dental probably it's still sufficient, for your checkups and all. But in terms of some customers, they'll say, hey, spectacle frames and contact lens is like not much cover, but it's good to have. You see, sometimes you might have a child who is studying overseas and you want them to, have an ease of to cover them in these areas. You can have the worldwide well-being benefit also. Evacuation, we cover for evacuation, repatriation, paid in full. And if there's an accompanying person, we will pay for to bring this person with you as well. And also for children, we can't possibly evacuate you and leave your children behind. So we cover the minor children also to evacuate them together with you. Right. Deductibles. Okay, this is also one common question. What deductibles? How do they work? Our deductibles is a combined amount per membership year. It is not per incident, per hospitalization. It is not per illness. It is per year. All the treatment that you have or all the visits to the doctor you have combined per year. So each module will have its own applicable deductible. In this case, the core plan, worldwide medical insurance, there's a range of deductible that you can choose from. Your client can have the most comprehensive cover with 0 deductible, or they can have the $11,750 deductible. It could be some people, they might go for the higher deductible because they also have a basic plan. Maybe they have an IP, a shield plan in Singapore, or their employer is providing them with some employee benefits that's very basic, but they are taking this as a top-up plan to enhance their coverage. So they can opt for the deductible. And how it works is that you can claim from both sides. Of course, we all know that we don't, the member shouldn't benefit from it, but we can claim from both sides. So for example, your client company plan paid the bill of 10,000, right? You can still send us this bill, the final settlement, and we will count this 10,000 into your deductible. You will count towards your deductible. So you will reduce your deductible by 10,000 and you have a remaining $1,750 deductible for this year to fulfill. Okay. And for Worldwide Medical Plus, the deductible is $240 Singapore dollar or 170 US dollar per year. Worldwide medicine and equipment would have Singapore dollar 120 or 80 US dollar for the deductible. These will all be counted separately. So let's say you have a claim under worldwide medical insurance, you fulfill the deductible, but you have to also fulfill the outpatient deductible if you go for outpatient treatment. But it's very easy to hit, right? $240. Easily 1 or 2 sessions, you will be able to come to this amount. Another thing is if your core plan has 0 deductible, then you have no choice. All your other optional modules will have no deductibles as well. But as long as you have chosen some kind of deductible, even the lowest deductible, you have some kind of deductible on your core plan, then automatically your Worldwide Medical Plus and Worldwide Medicine and Equipment will have deductible. So for the other 2 modules, well-being and evacuation, there is no deductibles applicable in all cases. Right? These are the waiting period that you can take note of. All right. The 10 or 24 months maternity waiting period, please ignore the 10 because the 10 is for some of our members who had joined long ago. So during those days, we still have the 10 months maternity waiting period, but it's not applicable for new business anymore. Currently, we only have the 24 months. Okay. Long-term medicine, there's also a 24 months waiting period applicable in terms of long-term medication because of course, we don't want people to sign up when they already are on long-term medication and they want to be covered immediately in this area. So therefore, this waiting period is in place. Next, we have the other plan. So we have two plans. We have already gone through one of them. Next will be Lifeline. Lifeline is very straightforward. It's a package plan. We have 3 packages for your client to choose from. All right, it's a set lunch. You either choose one of them and you're covered for whatever is included there. Very straightforward. The first one, Lifeline Essential, covers for hospitalization and surgery, similar to like the core plan under the Bihu plan. It covers for hospitalization, surgery, anything that you require during a hospital stay. Okay, it also includes cancer treatment, full cancer treatment as well. Next, we have Lifeline Classic. Lifeline Classic will include hospitalization and surgery and outpatient consultation. When we talk about outpatient, it is a specialist consultation. We don't include family doctor in Lifeline Classic. We also don't include the outpatient medication. All right. And for Classic plan, we also have maternity cover, maternity and childbirth benefits, subject to 18 months waiting period. Then we have the highest level of coverage under Lifeline Gold. Lifeline Gold is very comprehensive and there's is annual unlimited. So you can go for outpatient treatment, you can go for GP, medication is covered, health screening is covered, maternity, childbirth is covered. All right. You can also include optional benefits like evacuation, repatriation, and US cover. For Lifeline, take note that it does not cover pre-existing medical condition. So if your client wants to be covered for pre-existing medical condition, you don't need to look at Lifeline because it will cover. Okay, it will exclude. Same thing, you will see this table in the member guide. You can go through in details, but let me point to some of the more common waiting periods or the more common questions. Health screening, same thing. There's a 12 months waiting period for health screening. Health screening is only covered under Classic and Gold. You see this cross out, means it doesn't cover. Okay. Okay, what else? Hospitalization. It's mostly paid, it's all paid in full, anything that you require in the hospital. Right, same as the WHO plan. I think my screen is a bit stuck. Okay. Hang on, yeah, my screen, there's something wrong with my screen. Let me restart the share. Did someone just click on something? Sorry, let me restart my slides. I think I'm wrong with it just now. Okay, if you have missed the QR code just now, take this chance to sign in. Okay, we need you to sign in and sign out so that we can award you with the CPD hours after this session. There's no test. Now we try to make this easier for you. There won't be any test or online assessment after the session. We will award based on your attendance. Okay. Let me go back to the slide that we were on earlier. Okay, yeah. Right. Let's go to the Move on to the next slide. Okay, same thing. Advanced imaging is covered. Cancer treatment, we pay in full. Same thing. Whether you get essential or you get gold plan, we cover full cancer treatment. ATMP as well is covered in all 3 tiers, as well as, okay, maternity. Let me get, you see here, maternity cover. It is after 18 months of waiting period. Okay, we no longer have the 10 months waiting period. Right now it's 18 months because we see a lot of claims coming due to maternity. And it is driving up our claims cost as well. This is one of the reasons. So under Lifeline Essential, we don't cover for maternity, but under Classic and Gold is covered. Okay, same thing, there's a newborn care, which you can choose, your customers, they can choose to add their newborn after the baby is born, and they'll be covered for the first 90 days with no underwriting, and the underwriting would start from the 91st day, but there are some terms and conditions, right? Okay, same thing, there are deductible options available to help to manage the plan, or sometimes your clients might have this plan as a top-up, so they can actually opt for the different deductible levels here. Difference from the Bihu plan is that for Lifeline, all the covered benefits would be counting towards the same deductible. We don't differentiate whether it's inpatient, outpatient. They will all lump together to count towards the same deductible every membership year, right? Waiting periods, 18 months maternity, 12 months for health screening, and 5 years for HIV and AIDS drug therapy. This screen is very helpful. This page that you see here, the key differences between Bihu and Lifeline. This is a very good gauge to guide you to see what is more suitable in your client's case. You can ask them. First question I always ask is, do you have any pre-existing medical conditions that you want to be covered? Sometimes they want to cover the pre-ex condition. Sometimes they don't mind having exclusions. They don't mind having coverage with loading or exclusions. If they don't mind exclusion, you can look at both Bihu and Lifeline. But if they want to have the chance to cover maybe with loading, then you go for Bihu. All right. Then do they want to have maternity benefits? Are they concerned about maternity? If they want to have the shortest waiting period, you can go for Lifeline Classic or Gold. But if they're not concerned or they don't mind a longer waiting period, they can go for Bihu. Do they require specialist consultation? Do they want to have outpatient coverage? So if they don't want to have outpatient coverage, some people, they only want to cover for the major bills like hospitalization or cancer treatment. You can go for the Lifeline Essential or Bihu Core Plan in this case. So this is a very good comparison table that you can refer to, and then you can dive into the member guide to help you to find the details of the coverage. Okay. Just now we mentioned there are some rules surrounding the adding of newborn, because from the 1st of November 2024, we have implemented some additional rules surrounding the newborn care. So if the parent has been for Bihu, if a parent has been a member for 10 months, then we can cover the baby if we receive the application form within 30 days from baby birth. So if baby is born today, within 30 days, please send us the application form and we can enroll, we can backdate the start date of the newborn care coverage to the baby's date of birth. If otherwise, then the baby will enroll from the day we receive the application. And also if the baby is born of IVF, then we would have some underwriting also. Okay, so these are some of the rules that we would have for adding of newborn. But if you're not sure, you can contact us so that we can guide you on this. Okay, so there are some rules in place for Bihu as well as Lifeline. So just take note, if the baby is born of assisted reproduction technology, born in the US, born to surrogate, please come to us for further inquiries. Okay. Facilities finder. We have a website, there's the link is there. or you can even Google for Bupa Facilities Finder. You will find this this map, this thing that you can actually find the country that you are in and look for the specialists that are within our network, or hospitals that are within our network. Maybe if we have time later, we can show you an example. Okay, so basically you can use this page to look for the hospital or the clinics that are in the country that your customer is in. Maybe she wants to go to a hospital, but she doesn't know which hospital is within our network. We can look for it here.
Correct.
Yeah, so when you go for our network providers, we can do a direct settlement. It's very, very helpful. A lot of members, they like this. They come to us because they appreciate this facility where we can pay directly to the hospital. So it's not about whether you have money or not. Of course, our members, they probably have no issues paying most of the bills, but then when you are unwell or when your family member is unwell, you wouldn't want to deal with such issues, right? You would want the hospital and Bupa to liaise directly. You can do the payment directly to the hospital. You don't need to do all the transferring of money, getting the payment ready. Or some members, right, they might be like, they have dependents who are overseas. They have children studying overseas. They have elderly parents who are not residing in the same country as them. The arrangement for payment can take a toll on them, and then it could be quite a hassle. So it would be good to go to within our network so that we can do this direct settlement for them. And of course, our network, we are selective about who we work with. Our providers are people who we find to have at least a certain level of experience and service, to ensure our members are well taken care of. Right? Okay, so now your client wants to buy. So what do you do next? You can, or after this session, you can also go to this RHI website to sign up for our agent portal. So take note that we have migrated our agent portal. So if you previously had an account, please go to this the link to sign up again in order to regain your access to the agent portal. So what can you find in the agent portal would be member guide, subscription table, product summary, application forms. These are things that you need when you want to do an application. You can go there, or additional medical questions. Questionnaire you can get from there. Okay, so it's you don't need to have an agent code with us to sign this up. So as long as you are our intermediary, you can sign up for the agent portal's login, so you can access all the information, updated ones. Okay, what is the process like? Okay, so when you send in the application form to us, we will look at whether you require medical coverage or not. If you do, we will refer the case to our underwriters to get the final terms, whether it's an exclusion or loading. Sometimes underwriters might require more information, then we will come back to you. So maybe there'll be some back and forth to get additional medical reports or additional declarations, and then the underwriters will come to a conclusion and provide a loaded quotation, and including the terms, the exclusion wordings or the terms of coverage, and we will provide you with the loaded quotation. Your client can still decide whether to proceed or not with the application at this point. Okay, doesn't mean you go through the underwriting, then you must definitely take up. Okay, then there's also some cases where there's no medical condition, everything is well, we can straight away go into to activate the policy very quickly. All right, you can also do a preliminary underwriting with us. We require the medical declarations so that we can check with our underwriters. But prelim underwriting, we would not be able to give you a quote, but we can tell you whether we can cover or not, or we can cover with possible loading, or we could cover with exclusion. We can let you know this. That would be a faster process if you want to quickly know whether we can offer cover before you go into all the forms. Okay. So what do you need when your customer decide to proceed with the application? Of course, we need the fully completed application form, product summary. If your client is a foreigner, we need the copy of the passport. If he's a Singaporean or PR, we will require a copy of the ID. We have the KYC fact find form. If it is a non-face-to-face sale, then we require the non-face-to-face form. if they have any of these conditions here, high cholesterol, high blood pressure, heart condition, cancer, diabetes, we will require additional questionnaire. And the questionnaire, some of this questionnaire will require the doctor's signature. I think apart from the high cholesterol and high blood pressure, the other three will require the doctor's signature. Intermediary world, just now we mentioned your client would have access to members world. That's for our members. Intermediaries will have intermediary world. So when you log into once you submit your first case, you will have access to intermediary world. You can look at your customers' policy status, payment status, their policy documents, and you can also submit claims on behalf of your customer. Okay. We have some new business promotion in place. The discounts for Bihu, those above 40 years old will be entitled to 20% discount. For Lifeline, it has to be 40 to 60 years old. All right. Bihu, any other age less than 40 will 10% discount will be applicable. There's no family discount because for all ages you will be entitled to 10% discount. For Lifeline, there will be a 10% family discount as long as you have 2 or more people in the plan signing up together. Right? The new business discounts are only for people who have not been a Bupa member for at least the last 12 months, or if they're due to Bupa. If they were a Bupa member and they lapsed 2 months ago, they want to sign up again, then the discount is not applicable. Right? And your commission are given net of the discounts. That means the premiums after discount. That's what we use to calculate your commission. Right? Who do you contact? So this will be a summary of your contact points, important contact points. The sales team, we sit here, individual sales mailbox. You can call us or you can email us. Email us will be very fast. We will reply within our SLA of 2 working days, usually faster, but we will work within that timeline to get back to you. When you have any questions about prelim underwriting follow-up, you have members who are group leavers. Maybe they have a Bupa company plan, but they resigned from the company, they're leaving the company, and they want to retain the Bupa coverage. They can transfer to a individual plan. All right, and we can either at most time we can have a simplified underwriting or no further underwriting. So you can contact us to ask about this as well. Renewal request, you want to make changes during renewal, you can contact us through the individual mailbox also. You can send the application documents. When you have the application, you can send it to rhi-bupa@raffleshealthinsurance.com. For all the documents, the member guide, subscription table, health questionnaire, etc., you can get it from the agent resource portal. After you have so for things such as payment inquiries, credit card inquiries, you can contact the service team, our broker service team, right? And if your customer have any inquiries, like they require pre-authorization, urgent pre-authorization, they require evacuation and credit card issues, they can contact our customer service directly. It's a 24/7 service. All right, they can call us anywhere in the world through phone, through their Members World app, or through email, right? That we ensure that we will be able to attend to them the fastest way possible, because sometimes you might not be available as well, right? So I think we want to, at this point, also share with you something that we have, something a lot of you have been asking for. So let me stop this sharing screen first. Okay. So let me get this. Okay, give me a minute. This is freshly out of the oven. We just got it a few hours ago. It is a premium calculator. So in the past, a lot of you have a lot of problems. How do we derive at the premiums, right? How do we get the premiums? I don't know how to calculate the premiums. So now we can help you, right, with this tool. We call it the premium calculator. Let me just quickly run through with you. It's not loading.